so now we are going to be doing bony palpations for the head, neck, and skull. So we're going to start with the maxilla, which is
Maybe put your hair behind your ears.
oh yeah, which is going to be the upper lip bone. So right here, I'm going to palpate that. And then we have the zygomatic, which is going to be the cheekbones and also super close to the eyeball. And then we have the nasal bone, which is going to be this super small bone right here in between her two eyes. And not this part, this is cartilage, so we just want to do this little part, that's bone. Then we have the lacriminal bone, which is the inner eyes, super close right here. And then we have, lastly, we have the mandible, which is the jawbone, which is here. Hi, I'm going to be palpating the bones of the skull. So we're going to start with the frontal bones, which are right here. And then we're going to move on to the parental bone, which is here, right here. And then we are going to move on to the temporal bone. So we are going to follow the ear canal and go right above it to be right here. Then we're going to move on to the occipital bones, which is in the back. So I'm going to hold the front of her head, and it's going to be at the very base of her skull. And then lastly, the cerebral bone, and it's going to be right here. This is the occipital bone, so it's going to start right where her hair is, and it's going to be this back section, which we're not doing her neck. Now I'm going to be assessing the hypoglossal, and I'm going to have you stick out your tongue and lift it up, down, side to side, and that's a motor. Now I'm going to be assessing the accessory, which is a motor. So shrug up your shoulders, shrug your shoulders, and try to keep them up. Okay, she's all good. Now I'm going to be assessing the vagus test, which is going to be both sensory and motor. So I'm going to have you say hi, hello, hi. Okay, and then I'm going to have you just swallow again. I'm going to be assessing the glossopharyngeal, and so I'm going to have my patient close their eyes and stick out your tongue or open your mouth.
Okay, can you show your shoulders, please? Shrug and push down.
It's gum. Okay, so she tastes the gum, and this is both a sensory and a motor. So the other part is going to be putting my hands in your throat, and can you swallow?
Okay.
1, 2, 3. Now I'm going to be assessing the vestibular cochlear, which is a sensory nerve. So I'm gonna have you close your eyes, and
Is it name?
did you hear anything? Yeah. On which side? On this side. And how many? 3? Yeah, okay. Did you hear anything? Yeah, a clap, and it was 2 times. On which side? On my left. Okay, and now stand up. And I'm gonna have you stand on one leg and close your eyes.
Close your eyes. Same or different?
Okay, and you're good. I'm going to be assessing the facial nerve, and it is both sensory and motor, but we are only going to do the motor right now, and we will do the taste later when we do the glossopharyngeal. So for the motor part, I'm going to have you smile super big with your teeth, smile, 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 and frown, and scrunch your eyebrows.
Close your eyes.
Perfect. Now I'm going to be assessing the abducens, which is a motor. So you're going to have to look at my finger. Now we're going to go to the left, back to the middle, right, back to the middle. Now I'm going to be assessing the trigeminal, which is a sensory and a motor nerve. So, and tell me if they feel the same or different.
A water bottle?
Do they feel the same or different?
Okay.
Same or different? Same. Now I'm going to be assessing the trochlear, which is a motor nerve. So I'm going to have you look at my finger and follow it.
And keeping it loose at the same time will be good.
Okay, because I have like no more knee pain. I've had knee pain for like 2 months. Because I mean, I was working out like every single day on my legs and stuff like that. And then now,
first an
I
H,
feel like I can do squats
back
again,
to
but I
the
wanted to add
center.
someone.
We're going to do an
I would say as long as you work on your quads
and
Okay.
lastly,
and you're keeping it loose and strong, squats don't put a lot.
Okay, now I'm going to be assessing the oculomotor, and we are going to be doing a light test. So look at me, and this is going to be making sure that her eye movements are good. And we are going to be testing both sides to make sure.
You're walking a little bit
That-
better.
there we
can walk more.
Okay, now I'm going to be assessing the optic nerve, which is a sensory and vision nerve. So I'm gonna have you read my hoodie.
It says Costa Rica, Pura Vida.
I'm gonna be assessing the olfactory nerve. It's a sensory smell nerve. So I'm gonna have my patient close their eyes, and then they're gonna tell me if they smell anything.
It smells like
Like one video
kinda
for
like
this side,
alcohol.
and there's 2 other ones.
Yeah.
Okay, we are moving on to the pathologies, and we are going to start with an epidural hematoma. So this is when blood collects between the skull and the protective covering the brain, often after a head injury. This usually happens when a blow to the head causes a blood vessel to tear, leading to rapid bleeding. It can put pressure on the brain, which is dangerous and needs quick treatment. Lastly, we have the trapezius. The action for the upper fibers is going to be elevate and upwardly rotate the scapula. Middle fibers is going to be retract or adduct the scapula, and the lower fibers are going to be depress and upwardly rotate the scapula. Now the origin is going to be external occipital protuberance, ligamentum nuchae, and spinous process of C7 through T12. Now the insertion is going to be the lateral third of the clavicle, acrominin, and the spine of the spatula. Next we have the platysma, and the action is going to be depresses the mandible, tenses the skin of the neck, and this expressing fear or tension. Origin is going to be the fascia covering the superior parts of the pectoralis major and deltoid. The insertion is going to be the mandible, skin of the lower face. Next is going to be the sternocleidomastoid, and the action is going to be rotates the head to the opposite side and laterally flexes, and that's unilaterally. The origin is going to be the manubrium of the sternum and the medial clavicle, and the insertion is going to be the mastoid process of the temporal bone. Next is the mentalis. It's going to be elevating and protruding the lower lip. The origin is going to be the mandible, and the insertion is going to be the skin of the chin. Next is the buccinator, and the action is going to be compressing the cheeks. This helps with chewing food and blowing and sucking. The origin is going to be the alveolar process of the maxilla and mandible, and the insertion is going to be fibers blend with the orbicular oris muscle at the corners of the mouth. Next is going to be the masseter, and the action is going to be elevates the mandible. The origin is going to be the zygomatic arch, and the insertion is going to be the lateral surface of the mandible ramus and angle of the mandible. Next is going to be the orbicularis oris. This is going to be closing and protrudes the lips. The origin is going to be the maxilla and the mandible, and the insertion is going to be the skin and mucous membrane of the lip. Next is going to be the orbiculus oculi, and the action is going to be close the eyelids. The origin is going to be medial orbital margin and the medial palpebral ligament in the lacriminal bone, and the insertion is going to be skin around the orbit, especially at the lateral palpebral raphe. Next is going to be the temporalis, and the action is going to be elevates and retracts the mandible, which is your jawbone. The origin is going to be temporal fossa and temporal fascia. The insertion is going to be the coronoid process of the mandible and the anterior ramus of the mandible. Okay, now I'm going to start off with the muscle groups, and so we're going to start off with the frontalis. The action is to elevate the eyebrows and wrinkle the forehead. The origin is going to be epicranial aponeurosis, and the insertion is going to be skin of the forehead and eyebrows. Acute cervical spine trauma is a sudden injury to the neck, often caused by a car accident, fall, or sports injury. It can damage the bones, discs, or nerves in the neck, leading to pain, stiffness, or even paralysis if super severe. Immediate medical attention is needed to prevent long-term damage. A tooth fracture is when tooth gets cracked or broken, often from a fall, a hit, or biting on something hard. It can cause pain, sensitivity, bleeding, and sometimes the tooth may be chipped or even knocked out. Treatments depend on how severe the fracture is, but often requires a dentist to fix it. Throat trauma is an injury to the neck or throat, often caused by a direct hit, choking, or impact during sports or accidents. It can lead to pain, difficulty breathing or swallowing, and sometimes swelling or bruising. Serious cases can affect the airway and require immediate medical attention. Nasal fractures are breaks or cracks in the bones of the nose, often caused by a blow to the face, like in sports or accidents. Symptoms include swelling, pain, bruising, and difficulty breathing through the nose. If not treated, it can lead to crookedness or breathing problems. An irregular hematoma is when blood collects between the skin and cartilage of the ear, usually caused by a hit or blow to the ear. This can happen if contact sports or fights. If not treated, it can cause the ear to become swollen or deformed, often referred to as cauliflower ear. Temporomandibular joint dysfunction, or TMD, is a condition where the joint connecting the jaw to the skull causes pain or trouble moving. It can happen due to injury, stress, or jaw clenching. Symptoms include jaw pain, clicking sounds, or difficulty opening the mouth. Next is orbital fractures, and they are breaks or cracks in the bones around the eye, often caused by a strong impact like a punch or a sports injury. Now, these fractures can lead to pain, swelling, bruising, or trouble moving the eye. In some cases, it can affect vision, cause double vision if the bones or muscles around the eyes are damaged. Diffuse cerebral swelling, or second impact syndrome, occurs when someone gets a second-hand injury before fully recovering from a previous concussion. This causes the brain to swell rapidly, which can lead to severe brain damage or even death. It's very dangerous because it can happen even with a mild hit after the first concussion. A sport-related concussion is a brain injury caused by a blow to the head or body during sports. It happens when the brain shakes inside the skull, which can disrupt normal brain function. Symptoms can include dizziness, headaches, confusion, nausea, and it's important to rest to avoid further injury. The next pathology is going to be a subdural hematoma, and it's when blood gathers between the brain and its protective covering of the head injury. So it happens when veins tear, often from a sudden impact, causing slow bleeding that can build up pressure on the brain. This leads to serious brain damage if not treated quickly. Spinal cord trauma is an injury to the spinal cord, often from accidents, falls, or violent impacts. It can cause loss of sensation, movement, or control below the injury site. And in severe cases, it can lead to paralysis. Quick treatment is essential to prevent permanent damage.